I still remember the day my grandmother, Lucille, came back from yet another doctor's appointment feeling invisible. She was 87 at the time, a proud, independent woman who had spent her life raising four children and working part-time as a librarian. Despite her aches and pains, she always carried herself with grace. But on this particular day, she felt smaller, less certain of herself. She told me, "He just brushed me off, like I was too old to matter." That moment stuck with me because it brought to light a painful reality that many older adults face. Sometimes healthcare providers dismiss genuine concerns simply because of a number on a birth certificate. This isn't a trivial problem. Being overlooked or patronized by a professional you trust can lead to delayed treatments, unrecognized symptoms, or worse yet, an internalized belief that you should just accept discomfort as an inevitable part of getting older. That belief can chip away at your sense of pride. It can also make you hesitant to speak up when something's not right, leaving potentially serious issues to grow until they become overwhelming. I've seen this happen time and time again, and it doesn't have to be that way. Today, I'm going to share 8 specific warning signs that may indicate your healthcare provider is dismissing you due to your age. These signs are subtle at first, like a quick assumption that everyone your age has trouble hearing, or a gentle reminder that pain comes with the territory. But if you know what to look for, you can nip these interactions in the bud before they rob you of the dignity and respect you deserve. I truly believe that by recognizing these signs, you will feel more empowered to advocate for yourself, get the attention you need, and ultimately maintain the vibrant quality of life you've worked so hard to build. The stakes are enormous. When a doctor or nurse doesn't listen, they can miss clues that point to treatable issues. They might overlook new symptoms simply because you look fine for your age. And what if you're not fine? What if there's an underlying problem that needs addressing right now to keep you healthy, mobile, and engaged in the activities you love? That's why paying attention to these 8 signs isn't just about feeling respected. It's about safeguarding your health, your independence, and your pride. By the end of this discussion, you'll have the tools to recognize whether you're receiving the attention and thorough care you truly need. You'll also discover practical steps to speak up confidently, ask the right questions, and even consider a different healthcare provider if that's what it takes. I'll be sharing stories of real seniors who refuse to be sidelined by age bias and the remarkable transformations they experienced when they found healthcare professionals who took their concerns seriously. Some of the information you're about to hear is backed by growing research in geriatric care, much of which has been overlooked for far too long. In other words, this isn't just my opinion, it's a perspective that many forward-thinking professionals in healthcare are finally acknowledging. Before we dive in, let me quickly remind you, if you find these insights valuable, please subscribe and turn on your notifications so you never miss any of our new videos. Leave a comment letting me know your thoughts. Type 1 if you feel this content resonates with you, or 0 if you disagree. Your feedback helps me tailor future discussions so we can keep learning, growing, and standing up for our dignity together. I'll also let you in on a little secret. The 8th sign we'll talk about is one most people don't recognize until it's too late, so stick around. It might just save you from months or even years of unnecessary frustration. Let's get started with the first sign that your healthcare provider might be dismissing you because of your age. Here's a bold statement to set the stage. Far too many doctors resort to catch-all phrases like, "That's normal for someone your age," ignoring vital health clues that could be signals of a more serious condition. This is dangerous because it perpetuates the misconception that aging necessarily means constant discomfort or limitations. The truth is, while some aspects of getting older are inevitable, feeling dismissed and unheard should never be part of the package. One common misconception is that if you've reached your 70s or 80s, you're bound to have aches and pains that can't be helped. But consider the story of Ralph, who's 74. He had persistent knee pain for more than a year. Each time he brought it up to his primary physician, he was met with, "Well, that's to be expected at your age. Just take some over-the-counter pain relievers." Ralph trusted his doctor's words but couldn't shake the nagging suspicion that something more was going on. Eventually, Ralph switched physicians, and the new doctor immediately sent him for imaging. It turned out Ralph had a treatable ligament issue that, with proper physical therapy, could improve dramatically. The surprising insight here is that we often underestimate how many age-related symptoms can be mitigated or entirely resolved when given proper attention. There's mounting evidence that ignoring symptoms because they're common in seniors can lead to misdiagnoses. This doesn't mean you should panic at every twinge, but it does mean you deserve someone who will look deeper instead of defaulting to, "That's just how it is." If you find yourself hearing that phrase, "normal for your age," and it doesn't sit right with you, here's the practical step. Ask questions. Politely push back by saying, "I understand it's common, but is there a more detailed way to figure out what's actually happening? Or are there any tests we can do to make sure we're not missing something?" Sometimes simply voicing that you want more thorough consideration is enough to prompt a more careful examination. The emotional benefit of taking this step is huge. It preserves your sense of dignity and ensures you're not passively accepting a lower standard of care. Imagine the relief of finally knowing the real cause of your discomfort and the pride you'll feel for insisting on it. After all, you've earned the right to a quality of life that's not overshadowed by unaddressed pain or limitations. Now let's move to the second warning sign that might indicate your healthcare provider is dismissing you because of your age. Here's a direct challenge to conventional wisdom. Less is more doesn't always apply to medical appointments. A shocking number of older adults are only given 5 or 10 minutes with their healthcare provider, and during that time, their concerns are rushed. The misconception many seniors have is that this is just how modern medicine operates. Doctors are busy, so I should be grateful for any time I get. Meet Susan, age 77. She noticed a tremor in her left hand that was becoming more noticeable when she tried to hold a coffee mug or sign her name. When she went to her doctor, the entire visit lasted 7 minutes. He conducted a cursory examination and concluded, "It's probably just a benign shake, nothing to worry about." Feeling uneasy, Susan tried to ask more questions, but the doctor had already moved on to the next patient. Over the next few weeks, that tremor worsened, affecting her day-to-day activities. Thankfully, she persisted and saw a different physician who took her concerns seriously, scheduling a full neurological workup. It was then discovered that the tremor was an early sign of a treatable neurological condition. Had Susan listened to the dismissive approach, she could have lost precious time in managing her symptoms. The surprising insight here is that a rushed appointment isn't just a scheduling issue. It can be an unspoken form of age bias. When a healthcare provider fails to allocate enough time for your concerns, they may be implying, "Your issues aren't complex," or "You're not worth further investigation." That might sound harsh, but it often happens unconsciously, fueled by stereotypes about what's normal in older adults. So what can you do about it? Try requesting a longer appointment when you call to schedule. Many clinics will let you book back-to-back slots if you explain you have multiple concerns. Bring a concise list of questions and symptoms to the visit so you can make the most of your time. Don't hesitate to say, "I'd like to go through each point without rushing because they all matter to me." If your provider remains uninterested or impatient, it might be time to seek a second opinion or a different practice altogether. The emotional payoff for taking this step is a regained sense of control. Rather than feeling rushed and dismissed, you'll walk away knowing you've asserted yourself and made it clear that your health is worth the time and effort. The pride you gain from that can be transformative, reminding you that you deserve attentive care and a thorough understanding of your own body. If you're still watching and these insights are hitting home, please comment the number 2 below. That way, I'll know you're here, engaged, and determined to advocate for yourself. And if you haven't subscribed yet, consider doing so now to stay informed. Let's continue to the next warning sign. Here's a bold statement to start this point. When a healthcare provider blames everything on slowing down, you might be missing an important diagnosis. Many of us have internalized the misconception that feeling less energetic is simply part of getting older. But as research increasingly shows, fatigue and a general sense of low energy can be symptoms of underlying issues like thyroid disorders, nutritional deficiencies, or cardiovascular problems, especially in seniors. Consider Harold, age 80. He found himself dozing off every afternoon for hours, unable to engage in the hobbies he once loved, like woodworking. I just thought I was slowing down, Harold confessed. My doctor told me, "You're not 40 anymore." And that was the end of it. Frustrated but resigned, Harold nearly gave up the idea of ever regaining his energy. That changed when a friend recommended a geriatric specialist. During his first visit, the new doctor didn't dismiss Harold's fatigue. She ran a series of tests and discovered he had a vitamin B12 deficiency and a minor cardiac irregularity that required monitoring. Within a few months of taking supplements and adjusting his daily routine, Harold felt revitalized. The surprising truth is that pinpointing the cause of fatigue in older adults often reveals manageable or treatable conditions. Labeling it as just slowing down can prevent you from taking relatively simple steps, like adjusting your diet, addressing nutrient shortages, or tweaking medication, that could dramatically improve your overall vitality. So how do you tackle this issue? Start by asking for a basic panel of tests if your provider hasn't offered one. A check of your thyroid, vitamin levels, and heart health can unveil hidden imbalances. Don't be afraid to say something like, "I know it's common to slow down, but I want to ensure there's no underlying issue we could address. Would you recommend any tests?" If you're met with resistance or a dismissive shrug, remind yourself that many seniors continue to live energetically into their 80s and 90s by staying proactive about their health. Embracing this action can provide a monumental emotional benefit, renewed hope. There's immense dignity in realizing that you're not just tired because you're older, but instead have the power to uncover solutions that enhance your day-to-day life. Imagine how empowering it is to discover a minor adjustment that lifts your energy, allowing you to keep up with your grandchildren or pursue your passions without feeling perpetually drained. Now let's take a closer look at the fourth warning sign, one that often slips under the radar because it involves miscommunication about your mental or emotional well-being. Get ready for another eye-opener. The assumption that being forgetful or anxious is just part of old age can be downright harmful. It's a misconception that if you occasionally misplace your keys or feel overwhelmed, it must be a sign of inevitable cognitive decline. While changes in memory and emotional regulation can occur with age, it's also true that stress, depression, medication side effects, and other treatable factors can play a role. Take Louise, age 79, who started noticing that she felt unusually anxious whenever she left her house. Her doctor dismissed it as a normal reaction, saying, "Lots of people your age become homebodies. Don't worry too much about it." But Louise remembered how outgoing she'd been even in her late 70s. Something didn't feel right about the sudden shift. So she sought the advice of a professional counselor who suspected mild anxiety disorder, possibly linked to a past experience. Through therapy and learning relaxation techniques, Louise regained her confidence in social situations. She wasn't just old and nervous. She had a manageable condition that improved once it was taken seriously. The surprising insight here is that mental and emotional health can dramatically affect your overall well-being, sometimes even mimicking physical symptoms. Ignoring or trivializing these symptoms under the label, "you're just getting older," can lead to a lower quality of life and exacerbate conditions that could have been addressed early. One practical step to combat this is to track patterns. Keep a small notebook or use a simple calendar to note days when you feel especially forgetful or anxious. Notice if there's a trigger, like certain medications, specific social situations, or even diet changes. Then discuss these observations with a healthcare provider or mental health professional you trust. Don't let anyone brush aside your concerns with a casual, "it's just your age." The emotional benefit? Validation. There's tremendous pride in recognizing that your emotional experiences deserve attention and care, regardless of how old you are. By challenging dismissive attitudes, you protect your dignity and open the door to solutions, whether that's therapy, medication adjustments, or simply added social support. If you've been following along and you're finding these points helpful, comment the number 4 below. It lets me know you're actively engaged. Also, if you haven't subscribed yet, now's a great time to do so. We still have 4 crucial warning signs to cover, and the last one might be the biggest eye-opener of all. Onward we go. Here's the 5th sign, and it comes with a bold claim. Accepting generic medication advice without context can be dangerous, especially for older adults. Many people believe the misconception that a one-size-fits-all approach to prescriptions works fine, regardless of age. But seniors often metabolize drugs differently, which means side effects can be more pronounced and interactions with existing medications can be riskier. Meet Robert, age 76. He was prescribed a new blood pressure medication by a physician who didn't look into his full medication list. Within a week, Robert felt dizzy spells so severe he was afraid to leave the house. Concerned, he asked his doctor if the medication could be causing the problem, only to hear, "It's normal for people your age to feel a little dizzy now and then." Trusting that dismissal nearly led to a serious fall. It wasn't until Robert consulted a pharmacist, who explained that certain drugs can potentiate dizziness when combined, that Robert realized he needed a medication adjustment. The surprising truth is that not all doctors thoroughly review a patient's medication profile, especially if they're juggling multiple appointments or relying on incomplete medical records. This oversight can escalate into real harm, from increased fall risk to serious organ complications. By staying informed and proactive, you can protect yourself from unnecessary side effects. Practical advice? Whenever a new prescription is suggested, ask, how will this interact with my current medications? And are there dosage adjustments needed for someone my age? You might also request a brown bag review, where you bring all your medications, vitamins, and supplements in a bag for a pharmacist or a nurse to evaluate. This simple step often reveals interactions that go unnoticed in a busy clinical setting. Emotionally, taking command of your medication regimen reinforces your sense of dignity. You show that you're an informed participant in your own healthcare rather than a passive recipient. There's immense pride in learning the specifics of your prescriptions and making choices that keep your body strong, stable, and capable of enjoying everyday activities. Now let's move forward to the sixth warning sign, one that centers around how your personal goals and values are, or aren't, respected by your healthcare provider. Challenge the norm here. If you notice your provider never asks about your lifestyle goals or personal preferences, it might be a sign they're treating you based on a stereotype, one where seniors don't have much going on anyway. The misconception is that as long as your vitals are within a certain range, everything is fine. But healthcare should be about thriving, not merely surviving. Let's look at Stella, age 82. She's always been active in her community choir and dreamed of traveling with them to sing in different venues around the country. Her doctor never once asked her about these aspirations. Instead, each visit revolved around checking blood pressure, adjusting cholesterol medication, and sending her on her way. Stella felt like her passion and plans were invisible. Then she switched to a new physician who began the first appointment by asking, "What are your top priorities in life right now?" Stella mentioned her desire to stay mobile for upcoming trips with her choir. That doctor immediately discussed exercises and dietary tips tailored to preserve her vocal strength and stamina. The difference was night and day. Stella felt genuinely cared for, as a whole person rather than just a patient. The surprising insight is that aligning medical advice with personal goals often leads to better compliance and outcomes. If your doctor knows you want to walk around Disneyland with your grandchildren, they're more likely to focus on mobility and endurance, encouraging treatments and lifestyle adjustments that make sense for your real-world activities. Being recognized for your plans and desires is not a luxury. It's a crucial aspect of good healthcare at any age. Here's your practical step. At your next appointment, volunteer your goals. Say, "I want to travel comfortably," or "I plan to volunteer every week at the community center. How can I manage my medication so I can stay alert?" If the response is dismissive, you've likely encountered a red flag that your provider isn't taking your life aspirations into account. That might be your cue to look for someone else who respects where you see yourself going. Emotionally, having your goals honored does wonders for preserving dignity. It reminds you that your future is still wide open, and you have every right to pursue the activities and passions that make life fulfilling. After all, aging doesn't mean surrendering your dreams. If you've made it this far and you're still watching, please comment the number 6 below. That way, I'll know you're in this for the long haul and ready to advocate for your right to a fulfilling, self-directed life. Remember to subscribe if you haven't already. We have two more crucial signs to cover, and I don't want you to miss them. Let's continue. Let's flip another common assumption on its head. The seventh warning sign is a healthcare provider's refusal to consider alternative or complementary treatments that might offer relief. The misconception here is that all seniors should stick to standard prescriptions and procedures, no questions asked. But a growing body of research indicates therapies like acupuncture, gentle yoga, mindfulness, and nutritional counseling can complement traditional treatments effectively. Consider Jerry, age 85, who struggled with chronic shoulder pain. His doctor insisted on painkillers and cortisone shots without success. Jerry mentioned he'd read about certain strengthening exercises and even acupuncture that had helped others his age. The doctor waved off these suggestions, calling them unnecessary for someone so late in life. Feeling undervalued, Jerry found a physical therapist who specialized in working with seniors. They introduced a routine of mild stretching, resistance band exercises, and gentle massage. Within 3 months, Jerry experienced less pain and greater range of motion than he'd had in years. He later added acupuncture sessions, which further eased his tension. The surprising truth is that older bodies can benefit greatly from integrative approaches, sometimes responding even better than younger bodies because seniors are often more consistent and mindful about following a prescribed routine. Refusing to acknowledge these methods can signal that your healthcare provider doesn't see you as an individual with unique preferences and potential for improvement. Practically speaking, if your doctor dismisses every alternative treatment you bring up, ask why. Request an explanation that goes beyond "it's not necessary." If the answer doesn't feel satisfying or respectful, seek additional opinions. Look for practitioners, such as geriatric specialists or physical therapists, who are open-minded about well-researched complementary practices. Ensure they integrate these methods safely with any medications or conditions you have. The emotional reward in exploring broader treatment options is a sense of empowerment and renewed hope. There's a unique kind of pride in discovering that even in your 70s, 80s, or beyond, you can learn new methods to ease pain, boost flexibility, or enhance mental clarity. It's a strong reminder that your journey isn't limited by age, but guided by curiosity and the desire for well-being. We're almost at the final, and perhaps the most startling, warning sign. Let's move on and see how you can avoid one of the biggest pitfalls older adults face in medical settings. Now for the eighth and final warning sign: being encouraged or even pushed to sign off on major decisions without a thorough explanation. The misconception is that you should always trust the experts. But while doctors and specialists have training and knowledge, no one knows your body, your fears, and your hopes better than you. If you're pressured into quickly agreeing to a surgery, a treatment plan, or a do not resuscitate order without in-depth discussion, take a step back. Meet Eleanor, age 88. She was presented with a form authorizing a high-risk surgery to address her hip pain. The doctor spent less than 5 minutes explaining the procedure. When Eleanor hesitated, he said, "At your age, it's usually best to get this done and over with. You don't want to be bedbound, right?" Eleanor felt cornered. Something in her gut told her she needed more information. She contacted another surgeon who explained alternative options, such as physical therapy, weight management, and pain block injections. Ultimately, Eleanor chose a less invasive procedure that significantly alleviated her pain and came with fewer risks. Had she succumbed to the pressure, she might have taken on a risky operation that offered limited benefits. The surprising insight here is that older adults are often rushed into making big health decisions due to an assumption that they're running out of time or lack the capacity to understand. Don't let anyone pigeonhole you like that. Major medical choices, be it surgery or advanced directives, require clarity, weighing pros and cons, and sometimes even a second or third opinion. Your practical step: always ask for details on risks, benefits, and alternatives. Say, "I want to know if there's a less invasive route or if waiting a few months could be detrimental." Bring a family member or friend to appointments for support and to help you remember details. You can also ask for written materials or request a follow-up call before you commit. The emotional benefit is straightforward yet profound. You retain your sense of self-determination. Nothing undermines pride more than feeling forced into a medical decision you don't fully understand. By insisting on clarity and respect, you protect the dignity that should accompany every step of your healthcare journey. You've just discovered 8 warning signs that your healthcare provider might be dismissing your concerns due to age. From the quick brush off of "that's normal for your age" to rushed appointments, from ignoring emotional health to disregarding your future goals, each of these signs can chip away at your confidence if left unchecked. But here's the good news. You now have practical tools to counteract dismissiveness and reclaim the attentive, respectful care you deserve. The urgency of acting on this knowledge is real. When medical concerns go unaddressed, minor issues can snowball into serious complications. If you accept the brush off or the idea that you're too old to matter, you could inadvertently sacrifice your independence and comfort in the years to come. On the other hand, speaking up, even if it feels intimidating at first, can open doors to earlier diagnoses, better treatments, and the chance to live the life you've envisioned for yourself, whether that's traveling, staying active with community projects, or enjoying quality time with loved ones. Take a moment to picture yourself putting these insights into practice at your very next appointment. Maybe you'll ask for a longer consultation or bring up that lingering discomfort you've been reluctant to mention. Perhaps you'll question a medication or request a referral to a specialist who might offer a fresh perspective. Imagine walking out of that doctor's office feeling heard, respected, and fully informed about the path forward. It's not just a wishful scenario. These steps can genuinely make all the difference. Now I'd love to hear from you. Which of these 8 warning signs resonated with you the most? Was it the rushed appointment, the dismissive "that's normal for your age," or something else? Share your thoughts in the comments section. Hearing your experiences not only encourages others, but also helps me understand what issues most need attention in future discussions. If you picked up any strategies you plan to try, tell us about those too. Your story might inspire someone else to advocate for themselves more assertively. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. Your close friends, family, or any senior you know who deserves better healthcare. Your support helps me continue creating content that informs and empowers. Finally, remember that each step toward getting the care you deserve is a testament to your strength and self-respect. You've come this far in life, and your experience and wisdom are invaluable. Don't let anyone, even a doctor, make you feel otherwise. You have every right to make your voice heard and protect your well-being. Thank you so much for watching. Stay proud, stay proactive, and always remember, age is a part of who you are, not a limitation on what you deserve. I can't wait to see you in the next video. Here's to your continued health, dignity, and the bright days ahead. Take care and see you soon.